welcome back to the Mommy and Baby Show. I'm your host, Masi Tetu. We are now on episode number 5. And so today's topic, we'll be looking at labor and delivery, and we have Nurse Kisera who will be taking us through this. Welcome back.
Thank you for having me back.
So we felt that we discussed so well last week in regards to the stages of labor and what to pack, and we felt we wanted to add more details in regards to labor, and that's why we felt you would be the right person to handle this. So if you just go right into the questions. Now I already started my labor as we discussed like last week. I'm now at the hospital. Could you kindly walk us through from admission all the way through to delivery?
Okay, so it starts with the mom. You have a reason as to why you're coming to visit on week 38 or when you're at term. So you could be experiencing the earlier signs that we discussed of labor. 1 or 2 is enough for us. So you come in. So after you come in, you go through the process of registration for you to see a doctor. Depending again on the reason as to why you're coming, sometimes we'll walk you directly to the midwife so that you get your examination done. So it depends with the reason as to why you're visiting with us. Okay. So what we normally do, or for us to know that you are being admitted or in true labor, so the moment you hear the word admission, you are now with us, the reality checks in. Okay. So we do what we call vaginal examination to determine whether you are dilated enough or not. So after vaginal exam, we are able to say that you are in for an admission. Okay, so you could be 2 centimeters dilated with other factors, like you experience the blood issue. So that means you will not go back home. We'll admit you after that. Yes, so it depends with your mode of payment, you go through that as well. Depending again on your state at that particular time, you could walk back to the reception after the examination, or the reception will come to you for the process of admission. Yes, so that's when the reality checks in. Now we are delivering. Now we are here. We are not going back home until we get a baby. Yes.
I'm about to now get my baby.
Yeah, sure.
All right. So once I'm checked in, and now I'm going through the process of laboring up until when I will now give birth. In that delivery room, who typically has to be there?
So post-admission, let's say after you open your file, so that you continue monitoring labor. Okay, so you will monitor the mother, the baby, the state of what we said, the power, the passage, and now the passenger. So that at least we walk the journey together when everybody and every pass is okay. So during that particular time, depending on the reason as to why you are admitted, you will have a midwife. The midwife will be taking care of your baby, monitoring the baby, the progress of labor, yourself, the vital sign, the pressure, and everything. Then you could have a medical officer reviewing you from time to time. Yes. Then you see now that's the process of you are now laboring. You are not, let's say, up to 10 centimeters dilated now to the delivery. So to the delivery room, you always have your first midwife, the one who is waiting for the baby to come. Okay. Then you have your second midwife, the one who will be handed over the baby to continue taking care of the baby. Then the midwife one is continuing taking care of the for the rest. Yes,
Okay.
Yeah.
So usually we have 2 midwives.
Yes, 2 midwives inside the labor ward.
What about a gynecologist?
There could be a gynecologist depending on what you are managing, but it's not a must. So we always say if you come to delivery, it should be normal. You come in, you get admitted, you get monitored, you progress well. So if your progress is okay with us, you may not need a gynecology during that particular time. But a medical officer or a clinical officer will be reviewing you from time to time. Until now they tell the midwife you are good, we are just waiting for delivery.
Okay.
Yes.
And what about a pediatrician? Are they on standby, or will I have one inside the room with me?
So for RFH setup, we always have standby pediatrics if we need one, and of course you always have a standby gynecologist as well if we need one. So if we need them, it is us to appraise them that we have this particular mother and this is what we are managing. Could you please get alert so that if you give you a call, you are there in a minute or so. Yes.
Okay. So at RFH, do you offer any pain relief options for the mother who wants to know beforehand, so that maybe they can ask for this particular option, whichever you have, before she comes to give birth?
So good news is we have, the internet has it, everybody has the information, that there could be a way for easy labor.
Yes.
You're just there, but you're not feeling the pain, but the progress is there. So it is called epidural.
Yes.
So for RFH, for all our branches, we offer epidural labor. So if you're supposed to visit with us, we walk you through the journey so that we tell you when at least you're supposed to come, because the epidural is administered at some particular centimeters when you're in active phase of labor, so that it doesn't interfere with the labor. So we'll have a painless labor. And luckily enough for Kiambu Road, we had one which was successful.
Oh.
Yes. So it is happening. So we offer epidural for those mothers who have painless delivery. You'll just hear news that people go through labor, but for you,
You've never
experienced that.
So from your opinion, are there any pros or cons if I choose to go the painless way? Will it come back to bite me if I choose not to feel labor? Or is there a con of choosing the epidural over just going through the pain naturally?
So if you ask a second time mom who had experienced labor before, they will tell you, if there is an easy way out, I would go for that. Yes. So unless, if you're a first time mom, you may not know the reason as to why that would benefit you. But if you're a returning mom, you could say, if I could have an easy way, a painless delivery, I could go for that. So it always has advantages. So if you're a mom, you've carried the pregnancy for 9 months. If there is a easy way to deliver, you just go for it.
Go for it.
So it's always advisable for you to go through that baby girl treatment. Yes.
Okay.
So it's a sure thing you can choose that.
You can choose that. And is there a disadvantage? Will something, if I choose to go through epidural, later on, postpartum, will I have any negative effects?
There is no any negative
Zero.
effect. You're good. After delivery, your legs will go back. You'll be reversed. It's kind of reversing you back. Then you're back, then you're good. There is no any after effect. Like we say, all the processes of labor and delivery, it should be normal. Anything that comes, there comes as unfortunate complication. Yes, so there shouldn't no worry afterwards.
Okay. Yeah. So you mentioned if you're a second time mom and you have an option of going pain-free, you'll always choose epidural. So just to ask, if I'm having a pain-free labor, does that mean I can tell, does that mean I cannot tell when I need to push the baby?
Yeah, you will not tell when you need to push, but we always have the gynecologist on board with you. We have the midwife. So continuous monitoring, close monitoring, we will know when you are ready. So what we do, we tune your mind that now you can push. So you imagine you are pushing, but you can't get any pain. You're not feeling any pain. You're not feeling any urge to push. But you can see the baby is coming. The baby is crowning. So what we do, we tell you to push. So by imagining you push, then the baby comes out. So you don't feel anything. No urge to push, no pain.
So, that is interesting. And so I'll be directed throughout the
throughout the process. Yes.
So does it then it wears off after?
After, yes.
Okay.
Just like any anesthesia, it wears off with the time.
As it wears off, is there any pain?
You will not feel any pain. For vaginal delivery, there will
zero.
be no any. Yeah, there will be zero pain. Zero
that
pain.
Is interesting. So does that also mean I cannot tear?
You could tear.
You could.
Yes.
But
yes.
you will not.
It's a may or may not.
You will not
feel
it.
Yeah, you will not feel.
You're
still in the process of anesthesia, so you will not feel.
Okay. Yeah. All right. So nowadays we have women who choose to go through elective CS.
Yeah.
Like the same way you would opt to now have a pain-free labor, you decide you do not want to push and you want to have a cesarean section. Are there any advantages? Are there any disadvantages?
So one thing, you don't come to choose whether you're going through elective CS. We need to have a reason as to why. It's a scar. CS is a major surgery. So we don't want to give you a scar without a reason. So you don't go choosing that I am willing or I want to do elective CS. We must have a reason as to why we are going into elective CS. And that reason maybe is the baby or is the mother. So saving the two, you go in for elective CS. So it's not like a choice that you wake up one day, then you say I need to go for yes. Yeah.
Okay, so also want to find out at RFH, how do you handle emergencies during labor?
So, of course, all our branches who offer maternity or inpatient, we have a ready theatre. So that's almost one factor that you're supposed to consider when you're choosing a facility. Then again, you need to know, is the medical officer going to perform my emergency CS, if any, or do they have a gynecologist on board? So that in case of any emergency, you are able to know, you're able to go in as early as possible. So how we handle emergency means you come, we do continuous and close monitoring of the mother so that we're able to capture the tiniest complication that may arise. We know when to stop labor. So as I said earlier that we walk the journey with the mother. You are involved in your own care. So that you know the expectation. That if you don't get to that expectation, we should stop labor. Maybe it's the passenger. So we stop labor, then we go in for an emergency CS. So the setup covers for all that. Once we have a mother in labor, all the other team is ready. The nurse is somewhere knowing that there is a mother in Kiambu Road, in Ruaka branch, or in Ruari branch who is in labor. So that in case of anything, they get a call, they're able to get there almost immediately.
So you can be assured that every aspect is covered.
It's covered, yes.
Okay, so what's one thing a pregnant woman who is about to go through labor should keep in mind from your expertise? What can you let them know?
So what I can let them know is one thing, always trust the process. So once you realize that we are admitting you, we always tell you where we are, what we need to do, and the time we expect that by that particular time we should have our baby with us. Okay, so you should know that at each and every change that happens, your midwife or your doctor is supposed to discuss the same with you, so that if changes come to where people say they're just doing CSS, you are involved. You know why you went in. It's not like you are ambushed to go in. You know the reason as to why that you went in. So always know, is it the baby, is it the passage, or is it me? Sometimes it's the mother. Yes, yes.
So always keep an open mind.
Yes, keep an open mind.
Trust the process.
And flow the process, yes.
Okay, all right. Thank you so much. That's all we had for today. And I remember you mentioned in the previous week that you're at the main branch.
Yes, the Roy branch.
So anyone who still wants to see Nurse Kisera can find you there.
Yeah, you can find me at Roy branch.
Thank you so much for being here. So that brings us to a conclusion for today's episode. Remember to stay right here for next week's episode. Be sure to click in, check in. Don't forget to subscribe if you haven't yet. Remember to share this with a mother who's out there, a friend, a colleague, a sister. Information is power, and we want to empower all our women, all our sisters. Until next time, it's been a pleasure. Bye-bye.